about teaching work to actually start teaching your children. Then, hello and welcome to the Well Child Show. Hello there and welcome to another edition of the Well Child Show, brought to you by Global Child Health and Safety Initiative. My name is KEMAK, your host. Now, the vision of Global Child Health and Safety Initiative, as encompassed in the Well Child Show, is a healthy, safe and just world, devoid of abuse, where children can grow and flourish to their fullest potential. Sadly, the negativity that stares us in the face in this day and age is the increasing rate of children who abuse drugs. And this leads to a question: who is to blame? Why do children find themselves muddled in the horrible circle of drug abuse? Is it a negative effect of dysfunctional parenting? Can we blame drug abuse to environmental factors and peer pressure? Or is drug abuse simply a means that children use to cope with the difficulties of today's world? On the show today, I will be speaking on children, self-medication, and drug abuse. Stay with me, I'm going to take a quick break. When I come back, the Well Child Show continues. Don't go away. Hello and welcome back. Thank you for staying with us. If you're just tuning in, it's the Well Child Show with KEMAK, and my name is KEMAK, your host. Today on the show, I'll be talking about children, self-medication, and drug abuse. Now, worrying statistics staring us in the face puts at alarming numbers the number of children, young boys and girls, who abuse drugs. From the regular over-the-counter painkillers to the syrup used for cough and other forms of sicknesses and basic illnesses, we find a very disturbing trend. Children are beginning to abuse drugs, and that leads us to so many questions. Why exactly do children abuse drugs? What is the underlying motivation that encourages children to go into all different forms of drug abuse? Now, from research from the Medical Council, the International Medical Council has actually shown that drug abuse begins in children from the age of 12 and 13. That means that most individuals who will go on to become drug abusers in adult life actually have their first encounter with the wrong use of drugs. Now, before I go further, I'd just like to explain what exactly drug abuse means. Personally, I like to look at the word abuse as a combination of two words, AB standing for abnormal and use representing use. In essence, when we say a substance is being abused, what we're saying is the substance is being used abnormally. Now, everyone knows drugs are a chemical composition given to an individual to help with illness and to help them recover. But what we find out is that some of the effects of taking drugs in the person brings some form of euphoric feeling and some form of, esoteric pleasure. This, in a wide range of people, leads to why a lot of people, in order to seek those euphoric feelings and those out of the world experience, go ahead to use drugs without actually having the medical conditions that require the use of those drugs. I have a guest in the studio today, a clinical pharmacist, who will help us do justice to this topic. And I'm just going to take another quick break, and when I return, I will introduce my guest and the Well Child Show continues. Don't go away. Welcome back. It's the Well Child Show with KEMAK, brought to you by Global Child Health and Safety Initiative. My name is Onyekachi, your host. Today on the show, we're looking at children, self-medication, and drug abuse. And I have a guest in the studio. Her name is Onyekachi Nwakoby. She's a pharmacist who is passionate about drug adherence and public health education. She's also the founder of the MedGlobe Initiative, a health organization saddled with promoting health and medication adherence globally. You're welcome to the program, Onyekachi.
Thank you very much.
Thank you so much for joining us today. So before you came on air, we were looking at the definition of drug abuse. And I did mention to the viewers that drug abuse essentially is the abnormal use of drugs. Would you want to add something to that?
Well, you said it all. It's the improper use of medications, drugs, be it prescribed drugs, or even over-the-counter medications. It is just when you use a drug that you're not supposed to use for another indication or either for a wrong purpose. That is drug abuse.
So it goes beyond just using drugs wantonly to particular ailments requiring a certain drug.
Of course.
So if you use that for another drug, that encompasses
drug abuse. Yes.
Oh wow. So can you tell us a bit more about the different ramifications of drug abuse, or how exactly drug abuse occurs?
Okay, so well, of course, number one, self-medication starts drug abuse. So I have a headache and I don't know what to do. Maybe I'm stressed out. Now instead of me to maybe relieve that stress by resting, I go ahead to take paracetamol.
Oh wow, a lot of us are on this table.
I know. I have a little cough, I have a little cold. Okay, so I coughed out this phlegm and it is colored. I didn't go to the pharmacy. I did not speak to my doctor. I just go ahead to get antibiotics because I took it before and it worked for me. So, okay.
Oh wow.
That's fine. So self-medication starts drug abuse. That's the reason why I try to speak against self-medication first, because that is the number one reason for drug abuse. Okay,
seeing that we're dealing specifically with children in this context, and most of the time children may not really be the ones that administer these drugs to themselves.
Right.
A lot of times we have, and research has actually shown that adults that go on to abuse drugs later in life were exposed to a family setting where the wanton use of drugs was observed. So what advice do you have for parents, particularly mothers, right, who out of a desire for their children to recover, go ahead to self-medicate the children?
Okay, so the first thing, before you give your child any medication, please consult your doctor or your pharmacist. I will not even say maybe generally a medical professional, because some of them might not really know what that indication is or what that drug might be used for. So they might just prescribe anything that they've used before. So speak to your doctor. If you cannot go to the hospital, you can always go to a pharmacy. A pharmacist will always be there to guide you on the drugs to use. Do not use something because you've used it before on your first child. So that means it's going to obviously work on your second child too. That is not right.
Yeah, I was actually coming to that because a lot of times we've observed that parents share medication for children, especially. So what you're saying is, even though different children are exhibiting similar symptoms, would you say it is wrong to share,
Well, it depends on the medication per se. So you can share your multivitamins, right? Okay. Because it's not something, you cannot share your antibiotics. Now that medication was prepared specifically for a particular dosage and a particular dose. Now, if it is 5 days, you must finish it in 5 days. Everything has been measured. So you sharing it, you are reducing the dose of those children. Do you understand? So buy your own separate, get your separate medications for your children. It's not, you can share maybe your vitamin C, you can share your multivitamins, you can share your paracetamol, but antibiotics, anti-malarials, and other drugs, no. But
what you're saying about, ideally, if a particular drug has been prescribed for a particular child,
let that child finish that medication. There's no sharing. If the other child comes up with another illness, let him go and get his own medication.
Okay, here's another question that I've been meaning to ask, because sometimes, we go to the hospital and the doctor says, take 1 tablet of this 3 times daily. And well, most of our mothers, God bless our mothers, they have, you know, this passion or, you know, the eagerness to see their children recover faster. Does increasing the prescribed dosage of a drug speed up recovery for a child?
So before that medication was made, it had already been measured, like I said. Now, speeding it is, or increasing the dose, that is drug misuse. So you are overdosing that child. Now there are specific doses for specific age and even weight too. So even if you increase the dose, you are putting your child at risk of toxicity and serious side effects also, and this might also lead to death. There are people that have died due to overdose of ordinary paracetamol. So the pharmacist or the doctor gave you this particular dose for a reason. He must have checked the weight of the child, he must have asked questions about the weight, the age and everything, and gave you that particular dose. Please stick to it. At the right time. You don't expect your medication to work immediately. It takes time. It has to be absorbed in the body, undergo metabolism and other things before you can start seeing that effect.
So in essence, drugs are specific to individual children.
Yes.
And it's always best to stick
to the medication dosage.
All right. Now, looking at drug abuse as a general term, which of course research has shown begins in childhood with substance abuse, exposure to alcohol and all of that. What would you say is the core reason why children are found abusing drugs? From your experience, I know you do a lot of work on the field and, you know, charity work with, you know, individuals. What would you say from your experience is a major cause of drug abuse as observed
in children?
Yes.
I would say influence. Influence from their parents, influence from their friends, influence from their environment. So my mom I know that my mom, whenever she has a headache, she takes this thing. So I have a headache now, why won't I take it? That's drug abuse. That's the beginning of drug abuse. Or when I go to school, my friend takes this cough syrup and he gets so excited, and, you know, well, why shouldn't I take it? I want to be excited too. Or maybe I go for this party, or I go to see somebody and I see this person doing this thing, and this person looks cool because he's doing it. So why not? Why won't I do it? So I think it's just influence. They are being influenced by their mates, by their friends, by their family members, even their uncles, their favorite cousins, aunties, sisters. They see them doing these things. So why not? I want to be like you. I mean, so I can as well just do it too. Yeah,
that's a lot of influence, especially for children.
Of course.
And of course, as observed, children are the sum total of a child's life is the environment that the child grows up in. So now, what advice, as a medical professional, a pharmacist to be precise, what advice would you have for a parent who has observed, you know, that my child is dabbling into drug abuse? What advice would you have for that parent? What are the steps that should be taken to remedy the situation?
Okay, so number one, you have to observe the child. Then, you know, as you observe the child, you will know exactly where this influence is coming from. You can, maybe if it is from the school, you can go to the school, report the case, or even change the child from that school. Then, depending on how deep the child already is into this drug addiction or being addicted to that medication, you can take the child to a rehab center. That's just the best bet.
So you're saying, in order to combat drug abuse amongst children, it's a combined effort of both the family,
of course,
the school, and the society at large.
Exactly.
Wow, that's really interesting. Okay, now, what about talking about the use of drugs? Right? I know in our culture, the setting where we find ourselves, there isn't that much strict, you know, adherence to certain medical principles. Now, I'm aware that you're a member of the board of foreign trained pharmacists. Now, what would you say, what exactly are, you know, organizations such as yours doing in order to imbibe this culture of respect for the use of drugs in Nigeria, especially as it relates to children and medication? Okay,
so I think drug non-adherence is as a result of, I would say, being ignorant. So most patients, as I've observed, most patients don't know about these medications. Most patients don't know about the side effects of these medications. They don't know about what would happen to you if you do not take your drugs properly. So I think, and that's why MedGlue was actually formed. It was formed to educate the public, educate the society more on these drugs, on why to take these drugs. People come to the pharmacy, people go to the hospital, they just give them the medication, they don't even know the name of the drugs they're taking. All I know is I'm supposed to take it for 5 days, 2 times a day, and that is all. And then when they come to the pharmacy, oh, this medication is not working for me. Okay, ma'am, what did you take? I don't know. It was just a white pill. So if I know that if I don't take this for 3 days, this will happen to me, I know that I will definitely take my drugs very well. If I know that if I take this, I will get really well, I will definitely finish my medication. So I think it's just creating more awareness on this, educating the public more on these drugs, the indications, the drug information, and I think with that, it will be curbed.
Now, you also mentioned something in the course of our discussion, the issue of discontinuing medication, especially when symptoms have eased out. Now, can you please draw an inference between the moment where the symptoms ease out and when the disease is actually cured? Looking at the in line of stopping the medication for children, that's prescribed drugs for children, when their symptoms ease out.
Okay, so let me just take an example. Let me give an example with malaria. So malaria tablets, most of the malaria anti-malaria tablets is for 3 days, right? But before you come up with malaria, you are going to have the symptoms: fever, body pain, maybe loss of appetite, and everything. So obviously, as you start taking your malaria tablets, it is going to reduce those symptoms. But that does not mean that malaria parasite has been eradicated from your blood. That is the reason why you need to take for that 3 days. Because on the 2nd day, yes, there might not be fever again. The child might be more active now and everything. But you still need to finish that medication to prevent resistance. Because you might just maybe stop the parasite from growing, from multiplying, but you've not killed it from the system. You've not removed it from the system. So it's just going to remain stagnant. And then you stop taking the medication, and then they become resistant to that particular medication. The next time you're taking that medication, it won't work. Oh, wow.
So the fact that a child who was formerly ill and not very active suddenly becomes active some, way into the medication, it's not 100% assurance that the illness is gone or the parasite in the blood has been eradicated.
No, please.
Wow, thank you so much, Onyekachi, for coming on the show today.
Thank you very much.
We're definitely going to bring you back because this topic is really exhaustive.
I'll be glad.
All right, and to my viewers, thank you so much for being a part of the show. But let me take this opportunity to call on well-meaning organizations to come in and partner with us and support the work we do in bringing education and enlightenment on global best practices in child health and safety. You can also hook up with us on social media, our Instagram page popping up on the screen at The Well Child Show and at Global Child Health. We have our Facebook page that you can add us and interact with us. And for speaking and training opportunities and engagements, you can send us an email to info.wellchildshow@gmail.com. Now, this episode and previous episodes of the show are also available on our YouTube channel at Well Child TV. Thank you so much for being a part of the show today. I'll be back same time next week with another interesting and enlightening edition of The Well Child Show. Goodbye and God bless you.